This next chapter deals with child abuse and a corollary of it, neglect. Child abuse can be broken up into physical abuse, sexual abuse, and neglect, and then there's a subset even we call Munchausen syndrome by proxy, which we're all going to go over all of these. Physical abuse is any intentional injury in a child under 18 years of age. This will result in a variety of manifestations such as bruises, burns, fractures, lacerations, any kind of bodily harm. Munchausen syndrome is a subset basically of physical abuse. In Munchausen syndrome by proxy, what happens is that a caretaker inflicts some kind of disease basically or fabricates a disease on the patient. This can be something such as the mom will bring the child in because of having apneic episodes. Evaluation reveals that the patient is absolutely normal, has had a completely normal workup, and then it's noticed that the child, the mom is putting a pillow over the baby's face, thereby creating this cyanosis and apnea. Then she comes out and calls for help. I keep saying to mother, it's usually a female that perpetrates Munchausen's, and it's usually someone that has a little bit of medical background. So they may be like a nurse or a nursing student or something like that, someone that has some kind of exposure. Other forms of Munchausen's include inflicting diseases such as recurrent E. coli sepsis, basically because the caretaker is injecting feces under the skin. It contains E. coli, and the baby gets E. coli sepsis. There's a variety of ways of doing it. Baby might have, or the child may have recurrent episodes of hypoglycemia because they're getting insulin given to them. So you can see that these are things that are being inflicted on the baby. Usually it's a younger child because typically as the child gets older, they can fend for themselves and they won't stand for having that done to them. So Munchausen's is a fabricated disease. There's secondary gain on part of the caretaker because they get all this attention. Abuse can result in, besides the physical injuries, it can result in failure to thrive, developmental delays, and actually learning disabilities. Severe abuse can result in seizures, secondary to trauma, asphyxia. Risk factors for child abuse. Many times the caregivers themselves were abused as children. Also, it could be a young parent or someone who's being abused by their spouse. The list goes on to include drug abuse or a single parent. Someone who's under a lot of stress is more prone to be an abuser. A very common time for child abuse to occur is in infancy, for example, when a baby gets colicky. With a baby being colicky, they cry, they're very inconsolable for several hours, particularly during the night, and a stressed out parent sometimes gets mad at the child, and the parent will shake the baby and slam him up against the wall and abuse the child. Another time that's very common for child abuse is during toilet training. The child is still trying to regulate bowel and bladder habits, and many times will have an accident and the parents get frustrated and will abuse the child. Under physical abuse, we have areas of abuse of commission and omission. Commission would be something that results in fractures, spanking the child, hitting the child, slamming the child. Omission is more of a neglect issue, and that means not giving the baby proper food, clothing, or emotional support, basically not getting them to school or pursuing medical care. Those are things that are considered neglect or neglectful. Psychological abuse is also a form of abuse in the child. Not necessarily. Sometimes words hurt more than fists, so that you can terrorize the child or constantly put them down, tell them that they're no good, you don't know why you ever had the baby, things like that. That's a form of psychological abuse. Also, not loving the baby or showing tenderness as a forms of psychological abuse and neglect. Under the law, a physician is required to report. So you need to know how to detect and report child abuse. All child abuse, suspected child abuse, should be reported to the authorities. You are obligated by law. You are protected by law. It is making a diagnosis. When you are reporting child abuse, you are not reporting who did it. You're just reporting the fact that it was done. So you're not blaming anybody. That's up for the authorities to decide who did it. You're just basically saying, this child has been abused in one form or the other, and I am reporting it, and taking any steps necessary. You are not an accuser. You are not the police. You just report. When should you suspect child abuse? Well, again, it can be a developmental type question. The injury is not explainable by what the people are telling you, or a lot of times these stories, you sit there and you shake your head, they just don't make sense. So the classic example is the 2-month-old that rolled off the couch and has a depressed skull fracture because it fell. Well, we know that developmentally a 2-month-old shouldn't be rolling off the couch. A fall from a couch doesn't usually cause a depressed skull fracture. Another example is the 6-month-old that sits on the stoop and has a cigarette burn. Well, we know that 6-month-olds basically can't sit by themselves just yet, so how could it have happened? So the injury, the mechanism of injury, and the explanation just don't jive. Also a delay in seeking care. So this accident happened 3 days ago and the child has a fracture. Why are you coming in now? And as they start to explain these questions, they dig a bigger and deeper hole for themselves. And you just have to be aware that the story just doesn't make sense. When you suspect it, you need to document and photograph. You take pictures, you label the pictures, make sure that that's the patient's name and that's the date, because in court they might make it look bad if there's no label or date on it. And you look at the child top to bottom, and you have to remove them from that environment. And sometimes you can get the story from the child, sometimes you get a separate story from the caretaker, or different caretakers. One of the suspicious things is that, for example, the parents might bring in the child and their story is exactly the same word for word. Well, you can pretty much bet that they've been rehearsing what they're going to say so that they both get the story right. So you have to interview people separately. The bruises are very important, the distribution of the bruises, the age of the bruises. That gives you insight into the mechanism of what happened. Remember the shape of the bruises. The child may be hit with a spatula, and that will leave a spatula mark. So the shape of the bruises sometimes will tell you what happened. A slap with the belt will leave a distinctive strap mark on the baby. With the hands will leave finger marks on the child. So the size and shape of the bruises in different stages of healing, and you need to know your stages to see how old they are. The typical fresh bruise is, first of all, kind of reddish, and then it turns blue, then it goes to purple, and then it goes to a yellow, to a green-brown, and it fades into the surrounding skin. Don't get confused with Mongolian spots. Also, look at where the bruises are. A lot of toddlers are learning to walk, and they'll have bruises on their legs, and that's probably normal. But you look for other distribution of bruises. Here's a child, what we call the raccoon eyes. Those are black eyes. And it's very hard for a child to get hit that way accidentally because your orbits, the bones around your eyes kind of protect you. So this child's been abused. Here is a child who has multiple bruises in different stages. So here's a huge one on the face besides the raccoon eyes also, and different bruises, different stages of healing. This is a much darker one up here, and these are lighter. So these are different stages. Here's something on the hands, okay? On both hands. This one doesn't show up as well, but it's still something there on the hands. And here are basically almost like strangulation marks. Those are probably like a rope or a chain or something around the child. Again, more. This could be very well an iron. This is definitely an iron. That's the shape of an iron. You can have dunking into hot water, and typically when the baby first of all, if the baby is dunked with the feet into hot water in the tub, it'll look like they call it stocking distribution. It comes up just like a stocking, like a sock. Well, nobody jumps into the water with both feet at the same time into a bathtub, so that's very suspicious. When they're dunking the baby, it hurts. They will draw their legs up, so you might see burns on the buttocks, but where the baby drew its legs up, you may see some areas that are spared, for example, in the inguinal region. So look at the distribution. This was done right here by a curling iron that was applied to the baby's arm. Okay? This looks like a grate from a heater. Same here. So again, parents or abusers, and usually it's a caretaker. It's not someone that jumps out of the woods and beats the child up. It's usually someone that they know, a caretaker, a family member. These people can be very inventive in how they abuse the child. Look for certain fractures. Certain fractures are not going to be seen at an early age. Rib fractures are very rare, if at all, in an infant. Now, we already talked about osteogenesis imperfecta. Those patients will have fractures. Look for the blue sclera. But the parents might say, oh, this 3-month-old stopped breathing and we started CPR and we gave breaths and we gave chest compressions, because that would explain the rib fractures. You say, well, the ribs are broken. Well, we gave chest compressions. Well, it's very hard to break ribs in a little infant of 3 months of age because their ribs are very cartilaginous. It takes a lot of force to break a rib. So they try to explain things, they just dig a deeper hole. Look for what are known as spiral fractures. A spiral fracture of the femur before the child starts to walk is child abuse till proven otherwise. Okay? Rib fractures are also non-accidental. And you can also sometimes see callus formation when you get x-rays on the baby. Also, the location of the fractures, rib, the metaphysis, a very strange site to get a fracture. A fracture of your scapula, that doesn't happen very often. You should suspect child abuse. Okay? And also fractures in different stages of healing, multiple fractures like that should make you suspicious for child abuse. Here's a child, and you can see little check marks on the x-ray. Here's a child, and you can see rib fractures. Everywhere that there's an check, you'll see that that rib, for example, looks a little bit bigger than the area around it. Over here, it's a little bit bigger also. And certainly on this side, you can see that. And that one, it's a little kind of fat there. That's callus formation. There's a good one right there in that area. Okay, these are rib fractures. That just doesn't happen in this age group. The films that you want to get for rib fractures, you want to get a PA shot, and you want to get oblique shots to look at the ribs from a different point of view, and sometimes you can pick up fractures like that. Probably within the last year I had a case like that. Baby was brought in because he had a subdural hematoma, and we suspected child abuse, and that's what it was. But to get further ammunition, we went ahead and got more films. On the films, on the plain PA films of the chest, you could not really see fractures well. When we turned the patient a little bit and got oblique views, you saw fractures all over the place, and that helped convict these people. Here we have a patient that the x-rays look pretty benign, but if you truly suspect it, what you should then get is a bone scan. And all these areas there, all those little areas that are lighting up, here and here and here, those are fractures. So the bone scan is a little bit more sensitive. It's not going to be the first test. The first test you're going to get is just long bone films. Some people call it a babygram. We're going to get all kinds of films of ribs and the long bones and the skull to look for fractures. Here's a child who's been abused who has a fracture mid-humerus. And this one right here, you can just make it out. Right there like that, right across. That's a spiral fracture. That occurs because of twisting of the arm or of the extremity, and so it kind of like popping fresh dough. I don't get paid by those people either. But when you crack it open, that's what it looks like, and that's what you see with a spiral fracture. Here's a child with a supracondylar fracture. The arrow points right to it, and you can see that is not a typical spot for a baby to get a fracture. So it's the location that also makes you suspicious. Burns, another way of abusing the baby. They can place the baby in hot water. They can place the baby on a space heater. They can give them with curling irons. They can use cigarettes or lighters. And so you get characteristic patterns of the burns. Okay? The cigarette burn is a nice circular lesion, almost like a punched-out hole. And then impression burns occur from dipping the baby like I described. If you see a burn that looks like a sock on their feet, on both feet, this baby was dunked into hot water. Here you see burns that are by this lighter. What they did was they would get the lighter really hot and then put it on the baby, and you can see how the marks on the lighter here correlate with the marks on the baby, and they leave a definite impression on this child. This is done by a little necklace, a chain, and they just rubbed it on the child and made that impression. Same thing with this one, and this looks like a tourniquet injury or possibly even a burn from dunking. This is what we talk about, that distribution of like a sock. Head trauma, that's the most common cause of death, particularly the younger that they are, the younger the child. The younger the child when it's being abused, the higher the risk of mortality. So if abuse starts early on, less than 6 months of age, higher risk of mortality for the child. The problem with this child is they may get shaken and not have any external marks. So they may have head trauma, internal bleeding, but no external marks. We call shaken baby syndrome. And it's been changed now to non-accidental trauma, but a lot of us still call it shaken baby. You shake the baby, the head moves back and forth, the brain inside the skull is moving at a different rate, and so you get tearing of the bridging veins. These babies will then have a small subdural bleed. It's not so much the size of the bleed, but it's lack of oxygen to the brain. Sometimes these babies will present with episodes of apnea or maybe a seizure, and then the parents bring them in and you examine the child. So if you see a retinal hemorrhage and you have a subdural hematoma, how are you going to know that? You have to CT the head. That is child abuse in this infant until proven otherwise. And here you have a beautiful example. This is a baby with a subdural hematoma, this huge white area right here, and it's already causing a midline shift and compression of the ventricle, so this baby's already having increased intracranial pressure. And all these things that you see here and here, that's all retinal hemorrhage. Okay, so you put those two together, that's a shaken baby till proven otherwise. Intra-abdominal injury is the second most common cause of death from child abuse. And so they'll hit the baby in the stomach. I remember taking care of a child a long time ago who was adopted from another country. The parents brought the baby in, and well, she was like 7 or 8 years old by now, I'm sure. And examining her belly, she had this huge, huge scar on her belly, and that's because when she was much younger, someone had punched her in the belly. The parents, not the adoptive parents, the biological parents, had abused this child, and she had to bleed in the belly. She had to be taken to the hospital and had to have emergency surgery. So they will have blunt abdominal trauma from being punched in the belly. They can rupture the spleen or have a hepatic laceration, and also a small intestinal laceration or bleeds of the omentum. What do you need to do as far as your workup? Document everything. Document, document, document. You can write down anything that the parents tell you. It's not hearsay evidence. If someone tells the nurse something, the nurse can report it to you. You write it down. Label the pictures, and then you need to get certain labs. You certainly want to make sure that the child doesn't have some other disease that may be causing these findings. We already mentioned osteogenesis imperfecta. We want to make sure that the patient doesn't have any bleeding disorders. So a CBC is helpful. Coagulation studies like a PT, PTT, obviously the platelets from your CBC, and a bleeding time are all helpful labs. They'll all be normal in an abused child. A skeletal survey, those are the films I was talking about. You're going to get films of the skull at various angles. You're going to get films of the ribs and of the long bones, and that's your skeletal survey, and that's usually done for any child under 2 years of age that you suspect of child abuse. Some children 2 to 4 years of age will also get a skeletal survey. You probably don't have to do it once the child is more verbal and can tell you more of what happened, and you don't have to get an entire skeletal survey. If you suspect head injury, a CT scan is the best test, and you should always do a detailed retinal exam and even get an ophthalmologist involved to look at the eye. For abdominal trauma, an abdominal CT is very helpful. Look for, get a urine to look for any blood in the urine, and also get your liver enzymes and pancreatic enzymes. Again, always take care of the patient first. Remove them from the environment. Again, you are not accusing anybody. You're just saying, this has happened to this child. I suspect this has happened to this child. If you think the child's in danger, you hospitalize them and remove them from that environment. Report them to the Child Protective Services. They'll take care of the rest. Certainly, if they have severe enough injuries, they need to be hospitalized. Again, it's important to explain to the parents, this is what's happening. I'm not saying who did it, but we need to do something about this and prevent this from happening. You're not accusing them. You do need to tell them that the police and Child Protective Services will be involved in this case.